this actually. So clinical skills, essentially what it is it's probably the favorite topic for most medical students, especially preclinical, because it actually shows you doctorly things that you will apply to when you're in hospital. And it will be super important. This is probably not biased at all, the most important topic, right? Like your ethics, your law is really important, and it's important you know because you know the medical lawyers are there to support you, but you also need to know what is wrong and right. But this is probably the topic which, when you're thrown into the deep end and going into hospital, you will have to apply this knowledge so much. And this is also the topic where you'll build the knowledge the fastest because you'll learn one thing this week and then keep on building upon it in the following weeks. And you'll also learn examinations throughout the year as well. So, listening to people's hearts, listening to people's lungs, looking at people's tummies, etc. And also learn practical skills like doing injections, taking blood pressures, putting in drips, taking bloods, and you'll learn more of these over the different years. And you'll also learn how to take those like ECGs, which is like looking at the heart electricity. So, really big tips for this. Um, it's really hard to go out of your comfort zone and be like volunteer and say I'll do it, but ultimately everybody is there to learn. So really I do encourage you to have a go, see how you do. Like if you have concerns or questions, you can always bring them up with the teachers or the people taking the classes, and be willing to have a go and try, because the only way you're going to learn these skills if you repeatedly practice with others. And because these skills are very practical based, it's often really good to have a study buddy, which you do this with, and you can like talk through the questions, do the examinations, do the kind of listening to the heart, practice those types of skills, right? Because if you don't really have a partner to practice on, it's hard for you to really reflect on what you're doing right or wrong. Um, and you can practice with different people as well. And a really key skill in doing this type of thing is being able to use non-medical terms to explain things. So you can say something like, so a term that we use for a heart attack is called a myocardial infarction, right? Myocardium is basically, so we talked about endothelium, which is the inside of the heart. The myocardium is the muscle of the heart, right? Infarction is basically when you have like blood, the blood is not getting through there and there's damage to the heart as a result, or damage to the area as a result, right? So myocardial infarction is basically when we have damage to the heart due to a vessel being blocked off or blood not being able to get to the heart, right? In other words, it's a heart attack, right? So you need to practice the ability to, because you'll get so used to hearing myocardial infarction, that when you're practicing with your friends of kind of practicing asking these questions, you might say, ask them, have you had a myocardial infarction? In an actual patient, they will look at you like, what's a myocardial infarction? Or for some people, like it kind of varies with like patients. Some patients are like they know the terms because they've heard it a lot or they have had a lot of experience with it. Some patients won't. And it's just easier to use terms which everybody understands, just so your communication can be a bit more efficient and you can get your point across a bit quicker. Because some of these assessments based on this will also be timed as well. So you, instead of saying, have you had a myocardial infarction before? You can just say, have you had a heart attack before? Um, and most people will like be more accepting of the latter compared to the former, right? If you have any small group tutorials on this, please kind of like anatomy, make sure you read up on beforehand, or at least just like read through the things that might be going on. A really good site for this is Geeky Medics. They do really fantastic stuff. They're UK based, but medicine is medicine. It's the same everywhere. So just make sure you can have a read about them and like the steps they do, and they also have a lot of videos where you can see what's being done as well. So they're really good. So I would check them out in terms of the kind of practicing the skills.